All right, hello guys. So we're going to go ahead and move into our next chapter, which is, a lot of times people will just call it like the drugs chapter, but it's actually like toxicology. So we're going to be looking at like drugs and poisons, and some of this stuff can get a little like confusing sometimes, so which is why I'm recording myself so I can teach it to you directly, instead of having you read articles or other things. That way you can get my explanation of it too. So with this will be like our last kind of chapter for our forensic science class. After that, we're going to move into your final, and I will be explaining your final to you once I get all the stuff put together for it. All right, so we're going to go ahead and, well, talk about drugs and other things like toxins. So this field of toxicology. So toxicology, brief overview, is the study of poisons. And what toxicologists do, those are people who study harmful effects that these substances can have on the body. Oftentimes people who are going into like the health sciences or the medical field, they will even sometimes take a toxicology class to understand the effects that different chemicals and drugs and pharmaceutical medications will have on the body. Okay. So when we're looking at toxicology, it's kind of a wide range of like areas and fields, because there are toxicologists that focus on the environment. There are toxicologists that focus on like the medical aspect of things. There are toxicologists that focus on how different chemicals react with your living organism. So there's a lot of fields of toxicology, but obviously the one we're going to focus on is the forensics one. And this is where you have a forensic toxicologist, and they will work on detecting and identifying different drugs and poisons. A lot of times people don't think of poisoning as a way, or they don't like think about it when they think of toxins. And they'll look at how those toxins are used, so whether they were used for like medicinal, recreational, or criminal purposes. So with a toxicologist, their primary responsibility, so if someone is a forensic toxicologist, they will most often do post-mortem drug testing. So they will take tissue samples from, well, dead people or people they have found at crime scenes or from people in hospital settings, and they will use those tissues to identify what drugs, if any drugs, were used in that system. Sometimes they'll use blood too. It depends on how long that person's been dead, depending on what type of body part they take for testing. But what they're looking for is they're looking for what type of drugs are in the system, if there are any, and what that person could have done with those drugs. So they're looking to see, are these drugs conducive with someone who did like an accidental poisoning case? If there's things with drug abuse cases, suicidal poisonings, and homicidal poisonings, people who are in like toxicology, they can also kind of expand their field, and they can do like workplace drug testing, and then they can also do identification of contraband materials. So they could work with like police departments or jails or airport security to identify any possible drug or poison type materials. So exposure to toxins can happen in 4 different ways, which you are probably familiar with these. So the way that people get drugs, toxins, whatever it might be, can be ingesting them through their gastrointestinal system. So basically putting them in their mouth and ingesting them, digesting them. They can inhale them into the lungs, they can inject them into the bloodstream, and they can absorb them through the skin. Okay. So one way to think about this, when we're talking about the field of toxicology, it encompasses everything. So it encompasses like medication, even like your normal medication, like your Advil, and any type of like antidepressants or anything else that people take. Okay, it includes things like cigarettes and alcohol. It includes things like your street drugs. Okay, so when we're talking about toxicology, we're talking about a wide range of different chemicals that you can put in the human body for a variety of reasons. Okay, not just the bad drug stuff. We'll get into that too, but keep in mind this is right now an overview of kind of everything. Okay. All right, so I'm just going to put it all up there. So with your toxic substances, they can be classified kind of how they expect people were exposed to them. So if we're looking more at like the medical side of things, so were these drugs given to a person intentionally to treat some type of like illness or to relieve pain? Sometimes when they're looking at drug cases, they'll say, okay, was this like an accidental overdose, or did they combine drugs that they weren't supposed to combine on accident just because they didn't know? A lot of our child drug cases, so like if a child gets a hold of drugs, a lot of times it was an accidental thing, okay, where they took pills that they were not supposed to take because they weren't put up where a child could not reach them. And then the last one here, so was that toxic substance taken deliberately because of like a suicide attempt, or sometimes we've had some poisoning cases too where people, it actually becomes like a homicidal poisoning where they will give poisons or toxins to others. So when we're looking at how dangerous or how toxic something is, we're really looking at 4 different factors. We're going to be looking at the dosage, okay, so how much is taken, the duration, meaning like how often are they taken, what is the length of exposure, how it is taken, so is it ingested, inhaled, injected, or absorbed through the skin, and then interaction, so how do those toxins interact with different substances in the body, both naturally and unnaturally. So when we're looking at the vast array of everything from your like typical Advil or Tylenol, your simple over-the-counter drugs, or if we're looking to like heroin and the other street drugs, where do these fall to? Okay, so when someone is working in toxicology or looking at like pharmaceutical stuff, they're really looking at the properties of these chemicals or these compounds and kind of ranking them based on these factors. Okay, so keep in mind when I'm saying like chemicals and compounds, that's what medication is. Medication is chemicals. Street drugs, chemicals. Your food, when you break it down, technically is chemicals. So what it comes down to is like everything has that chemical formula, and it's based on what's in that chemical formula that literally defines whether a drug has a positive or a negative effect on the human body. Okay. Even though to us, drugs always have this like negative connotation, you have to keep in mind that they're in the same family as the drugs that you take to relieve pain or to make yourself feel better. All right, here we go. Okay. I'm not going to read through all of this, but with this slide, basically it's saying that forensic toxicologists, we're looking at the legal and the medical aspects of typically the categories of like alcohol, drugs, poisons, and toxins and body fluids. So a lot of times your toxicologists, they will work with pathologists. And so pathologists are the people who are typically doing autopsies on people. And they can either be doing autopsies for like forensic reasons, or they could be doing autopsies for like medical reasons to figure out like, did this person have a disease? So what they do, those two oftentimes will work hand in hand if there are drugs or alcohol that's suspected, or if the family just wants to check and see if there were drugs and alcohol. They can run a screen test, which is where the pathologist will take either blood, or they'll sometimes take different tissues. So they might take like a piece of lung tissue, they might take a piece of like muscle tissue and skin tissue, and they'll send it off with the toxicologist to the lab. And that toxicologist will use a whole bunch of different testing reagents. And of course, for each different type of drug, there are different chemical reagents which will tell you whether there was a positive or negative test. They will also be able to use like the mass spectrometry machine that we talked about in our blood, in that last blood article, that last ballistics article, sorry guys, that we talked about, where they were looking at mass spectrometry. That can also be used to determine the presence of any type of drugs, even if there's only a small presence there. Okay, so keep in mind that a lot of times the medical field and the forensics field has to work hand in hand. So what they are going to be looking for is they will look for if drugs or alcohol are present, or any other toxins. Okay, so they'll look if there's any other type of thing that is present at that time, and then they will sometimes often have to go to court, depending if it is a criminal case, and they'll have to provide evidence for that. So when we're looking at vehicular homicides, where people die in car accidents or someone causes someone else to die in a car accident. They'll look and see if drugs or alcohol were a factor. In sexual assaults, they'll look for some of the date rape drugs. They can also look for, like, if someone has to do a drug test before they become employed. Most jobs and careers do this nowadays. They'll look and see they'll do a wide range or a broad panel to see what type of drugs are done there. They'll also do testing on athletes for performance-enhancing substances like your steroids. Okay, so toxicologists have a wide range and can do a lot of stuff. Okay, now with forensic cases, poisoning cases don't happen very often. I think there's about 1% on average of the forensics or the criminal cases are actually poisoning. So a very small amount of deaths, especially crime-related deaths, are caused by this, but there are two different classifications. There's acute poisoning, which means someone is given a high dose of poison over a short period of time, and that can include cyanide is usually the big one that you hear about because it does produce immediate symptoms. It basically causes your blood to reject the oxygen that your body's trying to breathe in. And obviously without oxygen, your organs start to shut down, and so it actually affects your respiratory system, but then leads quickly to all organ failure. Okay, there was actually, so a lot of times people don't, they think poisoning is an medieval forensic thing, but there's actually 2 cyanide poisonings in the last 20 years that were pretty famous. There's obviously been more than that, but there was one in 2012 when a guy won the lottery and his wife wanted his money and his life insurance, so she poisoned him through cyanide. There was also a poisoning in 2014, Ferrante was his last name, I believe, where he went ahead and poisoned his wife because she wanted another child and he did not. Interesting. Okay. The next type of poisoning is chronic poisoning, and this involves lower doses of a toxin over long periods of time, and a lot of these are more accidental than purposeful, so mercury and lead poisoning. So if someone is exposed to these 2 chemicals, or these 2 elements I should say, then what happens is over time their body starts to reject things. A lot of your nervous system is going to be affected by mercury and lead, which is why they always make sure to warn people about the effects and try to avoid mercury and lead as much as possible. And I think I'm going to go ahead and stop there because the next part that I'm going to get into is going to take me a little time, and that's a good stopping point. So when I do these recordings, I typically try to keep it 15 minutes or under, just because I know I start to lose you after 15 minutes as well. If you ever have a question over any of this stuff, so I know this is just kind of the intro stuff and you might not have questions yet, but if you do have any questions, feel free to shoot me an email. My email is on my phone, so I can pretty much shoot it right back to you. And then we'll get you an answer here. Alright, so I hope you guys are doing well. If you need anything, let me know, and I'll be talking to you soon.